Our theme today is to break the silence, because we want each and everyone to talk about the mental awareness, to end stigma about mental health, to say that it is okay not to be okay, it is okay to cry, it is okay to share your issues that are disturbing you, and it is okay to go for support whenever you think that you have a mental health issues, and also to go for testing whether maybe you have mental illness that need to be treated. And it's also important maybe to report that at Nyeri County we have a rehabilitation center at our Ihururu Rehabilitation Center, where we welcome everyone who has issues with drugs and substance abuse, issues with mental health, just to visit that facility and get treated. Mostly, as per the statistics, mostly it's men who are affected, especially here in Nyeri. We've had a lot of suicidal cases among men, especially young men. So men are the most affected ones, and that is where I'm saying it is important to encourage our men to talk about it. It's okay for a man to cry. It is okay for a man not to be okay. It's okay for a man to share the issues that they are going through, because mental health in Nyeri is affecting more men. 90% of the suicidal cases that we've had in Nyeri men, especially the young ones. Through the Department of Health, we are holding men forums within the sub-counties, just calling men to come and talk to them about mental illness, mental issues, and also to get tested on any illness, because we know that men don't go for testing, and especially when maybe they find out later that they have chronic illnesses. We have men who are committing suicide.
May is the month that's dedicated to create mental health awareness and education. And one of the reasons why we came to Nyeri is because we did check out the statistics on the incidences of death by suicide. They have been increasing, particularly in the last 2 years. And most of the times, the reason why this happens is because of loneliness. And loneliness to seek for help and a safe environment for that help to actually be extended. The other thing is a lot of myths around mental illness. Already you can hear the crowd is saying they are not mad. But a mental illness does not mean that it is what we grew up seeing as a person walking in the street with ragged clothes, eating from the bin. That person is doing that because they lack the opportunity to be taken to the facilities that then would treat and offer help to cope with that mental illness. Most of the counties in Kenya are also struggling with alcoholism. Alcoholism is an illness. It is an intervention that one would seek to pacify that which they are not able to touch, to feel, and to express, and also to deal with the trauma that perhaps happened when they were a child, or even that is happening as they're living their life. So it's important to ensure that the public is aware that when you see someone spiraling off into drinking more, then you need to create a space where they can seek help and for you to offer that help. Nyeri County, we must applaud them. They actually have the only government-led rehabilitation facility. We would really like to call out on all the county governments to ensure that the hospitals are well equipped with resource persons who are trained and who can assess your mental wellness even as they are intervening for your physical wellness, because we all know there is no whole health without mental wellness.
So what I would like to say is that mental health is just illness like any other illness, and what we would like to urge people to do is, as a department, if somebody feels that he has an issue relating with his or her mental health status, or even the relatives or any other person finds out that this person has an issue, the best thing is to maybe take this person to the nearest health facility, the government facility. We have trained personnel there, and if they cannot be able to handle they'll just link that person directly to where that person can get help. So what I like to say is that there is help everywhere as far as somebody goes to look for that help. Unfortunately, so many people have mental health issues, they don't realize themselves that they have it. But those people who live with these people, those people who stay around with these people, they're the one who